noticed, it's election season. And the Democratic candidates have been talking about all kinds of different policies. And the main thing one of the big things that's been talked about is Medicare and Medicare for all. And all of the candidates have got their own spin on what it should look like, what it could look like, what it costs, and what their approach is to all of this. And I'm following an article by the American Prospect, and you'll have the link in the show notes. And the author, John Walker, does make a great point. He points out that Bernie Sanders and Elizabeth Warren have had an honest approach to this, whereas the other politicians have some varying levels of honesty, and I'll get into that. Now, currently, America spends 18% of GDP on healthcare. And according to a tracker set up by Kaiser, on someone that makes about a $50,000 a year salary, between what their employer pays for premiums, what they pay in state and federal taxes, what they pay in premiums out of pocket or pre-tax, well, that totals up to about $11,500, or over 20% of their paycheck going to healthcare, right? Now, that would explain the 18% GDP number, right? So what's been happening is that the government and the politicians have been hiding the true cost of medical insurance and healthcare in general. And the American public is not aware of what is actually going on, what things actually cost, what they should cost too, right? It's sort of like if you only get one bid from a contractor to replace the roof on your house and it's $20,000, well, you don't know if that's high or low until you see that the next guy was $8,000. So Bernie Sanders and Elizabeth Warren have proposed really showing the costs that we're currently incurring. But then they're going to persuade the American public to continue with the system, to continue with Medicare for all, and to simply eat the new raised taxes that they're proposing. So they say, yep, this is what it costs, pay extra, this is where we're going to get you. It's a tough sell, but it's an honest sell. Now, the rest of the Democrats, and arguably the current Republicans and the current Democrats and even the president, have not been so forthright about what things cost. Now, the numbers are astronomical, and healthcare prices have gone up year over year in the United States, right? But what's important to get is where we compare to other developed countries, right? And, I'll give you some statistics about European countries in particular. So, I'll also mention Canada. So Canada has a pure single payer system for basic care, and it has province level control or state level control. And last year it spent 10.7% on GDP when it comes to healthcare. Compare that to our 18%. Japan also has significant cost sharing, and it uses a mix of employer paid funds and local public programs, and they spend 10.9% GDP. Australia spent 9.3% GDP. The UK, Denmark, Sweden, and Norway all have socialized medicine with tiny private insurance markets, and they spent about 9.8 to 11% GDP, right? Now, here's the thing. So in this article by the American Prospect by John Walker, it talks about the problem was that in 1975, President Nixon lifted healthcare cost controls. He deregulated the market, and everything went helter-skelter from there. I think that is not an astute analysis, because you cannot call a market in which it takes $1 billion to get FDA approvals for a drug deregulated. No, that is highly regulated. It takes $1 billion in years to get a drug approved, when Labdoor.com is testing supplements for nothing, right? Next to nothing, and then simply asking the drug company or the supplement company for a commission, right? When, companies are paying other companies like Underwriters Laboratories fees all the time. Third-party inspections, third-party checking, third-party verification doesn't cost $1 billion to determine whether something is safe or not. Well, so we have a regulated market. Insurance is regulated, right? And so, in fact, it might be that the only solution is to further deregulate and to let nonprofits and companies really do their thing to lower the costs of healthcare. For example, if you just simply go to a subscription-based medical practice, a direct care practice in your local town or city, you can pretty much have unlimited access to a physician for around $90 a month, and have cut rate drug prices simply by paying cash and by being smart about it. You don't need to have insurance to simply go to your GP. So I would be wary of proposals from Washington and the various forms of Medicare for all, because they're not going to be cheaper, they're not going to save us money, they're not going to make us anywhere closer in terms of GDP, spending by GDP, than we are to Canada or Japan or any of these other countries. Their proposals simply won't work because the current incentives do not make healthcare prices cheaper, and we've seen this.